performing a cranial nerve exam and perhaps neurological test for patient 24601 here in Wing A of the clinic. Perfect. And hello there, dear. How are you feeling today? Good. I was sent by a nurse and a doctor to give you an assessment of your cranial nerves and a bit of a neurological test. Yes. I am Dr. Moon, and I study nerves, neurology, and trauma patients. Yes. And based off of your report, it appears you have taken a tumble and got quite a bruise and a cut on your head. Do you remember how that happened? No, and that's okay. It also says so on your report. Now, before we begin, a quick sign-in. What's your name? Good. Proper neurological function and remembering. What's your birthday? Thank you. Do you know what date and time we're at? Year, month, perhaps day? Okay, proper good. Perfect. And how do you feel right now? I did read on your chart you were experiencing some vertigo and a bit of pain. Okay. We'll make sure to keep that in check then and make sure you're feeling okay. But now that you're all signed in, what I'm going to test is functionality of your neurological functions, and especially up to trauma to the head. It can be very difficult to know what has been affected, so your brain function is perfect. I'm first going to test your eyes. Yes. And just grabbing my readers here. I did read on your report that one of your eyes next to the trauma was affected, so let's test that. Perfect. May I first just touch around the eyes? Thank you. So very carefully going to just... Okay, do you feel any pressure or sensitivity or pain? No. Okay. Okay, now I'm going to feel around the forehead, particularly around the accident spot. Good, so okay, going to get a bit close up now. And I do see that there is a bit of swelling and sensitivity, which could be not allowing the eye to perform as it could. This could affect optical nerves and could affect in a cranial examination study, as followed by the result of the swelling. So eye functionality could be decreased. I should keep that in notice when I do that. Okay. So, okay. No sensitivity. Enter that feeling okay? A bit woozy. Okay. Vertigo caused by light. Okay. Going to proceed further. Going to check each eye for optical visual fields. Okay. So, going to first go to this eye, and I would like you to just look at me. Okay. And if you could, please look up to the sky. Perfect. Down to the ground. Thank you. To your left. To your right. Okay. Now follow the light very carefully. Just going to go to the corner there. And then vertically, laterally, horizontal, corner, down, opposite corner, and to the other side. Okay, functionality perfect for non-trauma eye. Now going to go to this eye. Just going to very carefully hold the eye. Look up. Look down. To your left. To your right. Perfect. Now follow the light. Okay. Horizontal perfect. Lateral movements assessed. Eye functionality a bit behind, but working. Horizontally. Upper corner. And up. Okay. So, assessment of trauma eye has been seen as smaller function of the test. Okay. Now I'm just going to take my finger and going to place it close to each eye to see how your eye reacts, okay? What I want you to do is stay completely still, as this is an exam, to see how your eye reflexes, okay? So, very carefully follow my finger, okay? Thank you. So, okay. Okay. Now to the center of the nose, just follow my finger with both eyes. Wonderful. Okay. Functionality on the eye with the trauma appears to be lacking by a bit, but reflexes still work, and iris and pupils appear to be functioning proper. Okay. Functionality appears to be perfect for the non-trauma eye. Again, the other one proves to be lacking. So, next I'm going to pull up a Snellen's test, and we're going to test your visual activity with reading. Yes, so grabbing my computer here, going to pull up a chart. I'm going to just carefully close this eye. Could you read to me the first letter on the top? E, okay. What is the second line? F and P. And what is the lowest letters you can visually read? Okay. L, P, E, and D. Going to lift the chart up a bit. Do you see what colour this is, and can you identify it? That's green, correct. And that's red. Perfect. We're going to switch the eye now. Going to close this eye. What is the top letter you read? E. Okay. Second line. F and B. And what's the lowest line you can read to? D, E, F, P, O, T, E, C. So, the line down here. Perfect. Is it difficult for you to read? No. And your record said you did not wear any glasses or contacts, and that you had no visual problems prior. Did you notice that after you fell, one of your visual sides and visual fields has been impacted quite a bit? Yes? Okay. Thank you. That concludes the eye exam. Analyzation of eyes complete. Lack of ability to do trauma of other eye is successfully assessed. Next, we're going to work on olfactory senses and gustatory. I'm going to quickly get my gloves. These exams go by very quick. Are you feeling okay? Good. So, with my gloves on, I'm going to show you that I actually have 6 different bottles, and these ones are for olfactory tests, the other ones are gustatory. So, first going to take a look at the bottle. And I'm going to just put this underneath your nose. Could you tell me what you do smell? And quite indeed, that is a woody oak smell. You're going to call that tree. Perfect. It is actually cedar. Perfect. Good job. The next one is a bit more generic. Not as fancy. So, take a guess at what you do smell here. A flower, very good. And what would you say the background smell is? A rose. Lovely. Fantastic. Next. Oh, I do love this one. Just give this one a go as well. And what do you smell with this one? Okay, a bit smoky. A fireplace. Perfect. And this one is actually to test Next we're going to test gustatory, and we only have 2. So I'm going to take this. I'm just going to place this on your tongue, okay? Okay. And could you tell me what that is? Very, very sweet. Perfect. That's exactly what we are going for. And the second. I'm going to test that on the tongue, please, very carefully. 2, 3. And I can see an instantaneous reaction. It is sour. Good job. So, sour and sweet. Perfectly working. Thank you. Now, we're going to go on to the part of the test that tests muscular function. So now, I'm going to ask you to mimic me, okay? First, I would like it if you could just raise your eyebrows. These functions will help see neurologically if your cranial nerves are working properly, even though I do know they look a bit silly. So, I'm going to place my hands right over your eyes and raise your eyebrows. Thank you. Okay. And I'm now going to place my fingers on top of the eyebrows. I would like you to try and close your eyes as tight as you can when I do, okay? So just carefully placing the fingers there and just close your eyes as tight as you can. Perfect. So now, just generally speaking, just close your eyes as tight as you can. Perfect. So I'm now going to pull under the eyes, and I would like you to try closing your eyes again. Okay. Lack of function in the eye of trauma. So muscular-wise, the swelling must be taking up quite a bit of the space underneath your eyes, but that's not a problem, you're recovering. Good. Next, I'm just going to put my hands on your cheeks, and I would like you to give me a very big cheesy smile. Thank you. Just very carefully. Very big smile. Thank you. And can you smile now? And could you just try and close your teeth as tight as possible? Okay, functionality good there. Now, going to place my finger at the top part of the lip, and I would like you to move your lip like that. So, very carefully, just purse your lips out. Thank you. That's perfect. Going to put my hands on the side of the mouth, and I would like you just to make a O shape. Perfect. Now, frown for me. A very big frown would be perfect. Amazing. Now, going to put my hands underneath your chin, and I'm going to ask you to just carefully swallow, okay? Thank you. Functionality of the jaw is working perfectly. I'm now going to test your lymph nodes. So, just going to check around the area, the lymph node processes. No swelling, so probably no infection due to the area. Okay. And now I'm going to place definitely feeling a vertigo, a dash. Okay, so equilibrium balance is a bit off, probably due to a neurological imbalance, but eye functionality, sensory and muscular functions are proper. And now it is time for me to assess your results. Yes, neurologically speaking, I know you're doing fine. But the trauma on your forehead does give me a bit of worry as a doctor. So I'm going to send you to an eye and ear specialist so that you can get properly checked, as vertigo could be a possible sign